Within seconds, she said, Doc, my right shoulder feels less stiff. She started moving her shoulder around. Then she said, my right elbow feels less stiff. And then her face just breaks out into a smile and she says, Doc, I can feel the right side of my face again.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts. Or download each episode and listen to it on the go. Let's get started with today's episode.
This podcast provides general information about health and wellness. The information is not intended to be medical advice. If you have a medical condition or concern, please find a medical practitioner that you trust and get a professional medical evaluation.
Good day, and welcome to another episode of the Healthy Reasonings podcast. I am Dr. Andre Williams. I realize I've not been introducing myself each time I have an episode, but today I will. I'm Dr. Andre Williams. I'm a Jamaican integrative oncologist, and I've had global experiences, the details of which are found in episode 1. So if you want to hear a little bit about me, then you can listen to episode 1. It's all there. But if you want to hear a little bit about today's episode, know that today's episode is going to be about one of my favorite tools that I use in the office. And no, this tool is not a hammer. It's not a screwdriver. It's not a drill. It's actually a technique. And this technique is known as neural therapy. Neural therapy. Neural therapy. And to talk about neural therapy, we must first, as usual, lay a foundation about how the body really works. And I want you to imagine for me that the body, instead of being a collection of different organs or a collection of different systems, what if we thought of the body as a circuit board? A circuit board. Now, sometimes you look into the inside of your computer, those of you who are curious, or if you're like me and used to pull down your toy cars, when you were younger, and your favorite toys, you'd pull them to pieces to see what made them spin. You would know that most of these devices have a circuit board. For those of you who may have had a phone that got damaged, you may have heard that the reason it got damaged was because the circuit board was damaged. You may have heard the same for one of your electrical appliances. And the point is that this board is really a collection of a network of different electrical wires or electrical connections that communicate messages by way of electricity across that board in order to send signals back and forth for the proper operation of, in this case, your phone or your washing machine or your dryer or your fridge. All of these devices have a circuit board that is sending electrical signals throughout that board, from fuse to capacitor and all of these names that I used to know in physics and electronics as a part of physics. And we can think of the body as exactly the same type of thing. If we think of the body as a circuit board, it's in a way it very much is, then all of these nerves that we've spoken about, which we call the autonomic nervous system, and indeed the nervous system as a whole, could be considered to be a network of electrical wires sending signals all across the body. And if you get into a little bit more detail and advanced biophysics, then you start to realize that maybe it's moving even faster than electricity could. But for the purposes of today's demonstration, we are going to assume that these are electrical wires. What that means, therefore, is that the brain sends a signal onwards or receives a signal from the rest of the nervous system in the form of, let's use an electrical signal going from, let's say, from the brain to the fingertip on your left hand. Now, all of your soft tissue of the body, the muscles, tendons, and I'm not going to get too technical, these now behave almost like little maps upon which all of these wires are running, and they provide a framework within which the wires exist. And so the wires are embedded into this framework, and they send the signals all across the body. Now, as we know, the body is very intricately made, and so these signals, they're going pretty fast, but they're also usually extremely accurate. And if we think about the autonomic nervous system in particular, one of my favorite parts of the systems of the body to discuss, we recognize that there is so much happening every millisecond of our lives. I just walked into this room and the air conditioner is trying to get the room to a certain temperature. And my body is adjusting to that as well. Even as the AC tries to do that, my body is also adjusting. And so the foundation of the approach to neural therapy is that the body is behaving like a neural network. A network of electrical wires, in this case, we call them nerves, that are sending signals back and forth, and all over the body every millisecond. Now, I want to detour just for a short minute to point out to you that the autonomic nervous system touches every cell of our body, including the the cells that are circulating, the white blood cells that are flowing through our bloodstream. Did you know that those white blood cells have, in some cases, receptors for the messages that the autonomic nervous system sends out? Meaning, the autonomic nerves can send off a liquid substance into the bloodstream that then finds the appropriate cell and delivers the message to that cell by way of floating through the bloodstream. Which means, therefore, that this habit that we are into nowadays in science of disintegrating the body and dividing it into different systems for our own use is not going to be helpful for meaningful impact on the body. Because it separates without bearing in mind that there is one signal unifying network. And it is this balance that the body is constantly striving to achieve by way of the autonomic nervous system. So even the very white blood cells, in this case natural killer cells, a very brilliant doctor in Australia discovered that these cells have receptors for, in this case, a substance known as acetylcholine, extremely helpful for sending signals throughout the nervous system. How does this help us? Well, it helps us because if we think of the body in the right way, then we'll be able to better approach a way to help the body to repair itself as needed. Now, notice the words I chose there, very carefully chosen words. I didn't say we were going to repair the body. I said we are going to help the body to repair itself. And that's a critical difference between, in this case, an integrative approach and the standard approach that we do sometimes as conventional docs, which is to essentially force the body into a state that we want it to go into so that it functions better. A better way is to assist the body to heal and repair itself. And this is exactly why I love my tool called neural therapy. And it isn't even really my tool per se, but nonetheless, it's my favorite tool to use. In the same way that I don't think your carpenter invented a hammer or a specialized type of wrench, but nonetheless, it may be his favorite tool to use. So we're going to jump into what neural therapy really is right after this informative break.
In a world that moves too fast, it's easy to lose touch with what truly matters, your well-being. At Teshuva Wellness, we believe in a return to balance, to healing, to your best self. Our holistic approaches nurture not just your body, but also your soul. Whether you're seeking peace, energy, or a deeper connection, we're here to guide you every step of the way. Our medical experts specialize in holistic treatments for chronic diseases, ranging from autoimmune illnesses to cancer. Our treatments are safe, non-toxic, and effective. Because at Teshuva Wellness, your journey to wellness is our greatest commitment. Visit our website today at teshuvawellnessjae.com or call 1-876-787-8197. That's 1-876-787-8197. Teshuva Wellness. Return to health. Return to your best self.
All right, we're back. And we are talking about neural therapy today. And neural therapy is, I'm pleased to say, about 99 years old. The practice called neural therapy is 99 years old. That's arguably longer than several other medical techniques. That's all I'll say about that. And the practice originated in 1925. So in 2025, it will be 100 years old. A German surgeon by the name of Ferdinand Hunecke, Hunecke, used a pain drug called Procaine. Now, I recognize that I'm quickly approaching another generation, and I'm quickly realizing that in many cases I'm unable to relate to the generation that follows me, which I find really sad. But nonetheless, I think there's several of us listening now who can remember going to the dentist and being told that they had to numb the area in order to extract the tooth. And the numbing agent that was injected into your gums goes by one of two names. It was classically called Novocaine. And in Jamaica, we often actually call it cocaine. Patients will say the dentist cocained their gum. But it's truly the generic or the active ingredient in Novocaine is Procaine. 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 And it's a local anesthetic. Now, a local anesthetic, for the purposes of this podcast, it numbs the area by changing the electrical voltage of the nerves that are carrying sensation to the area. And by changing the electrical voltage, it interferes with the pain signal that would normally be sent by that nerve. The effects are usually temporary, but it is because of these local anesthetic effects that the doctor can do things like numb the area before doing a a minor procedure on you, or the dentist can extract a tooth without you being aware of it, because the signal that would normally be sent by those nerves is interrupted because the voltage is changed by injection of this drug. So this drug called Procaine is not a made-up drug. It's a drug that has widely been used for several decades, and it has been used particularly in the area of dentistry. Now, the easiest explanation for why it is not used as widely anymore is that it is broken down very quickly by the body, and as a result of that, dentists and other doctors were eager to find a solution that was a little bit more long lasting so that they could do longer procedures as needed. Nonetheless, Dr. Ferdinand Huneke, as the story goes, used what was essentially a new drug at that time in 1925 on his sister who had severe intractable migraines. And instead of using it intramuscularly as it was normally used in that time, he injected it into the veins. And to his surprise, the migraine attack stopped immediately. Now, he had a brother called Walter. The both of them were medical doctors. And so they thought to themselves, hey, this thing is relatively harmless. There's no known side effects from its use. Wonder what would happen if we started using it for other conditions. And because they were accredited medical doctors, Dr. Ferdinand was a German surgeon, they had the ability to offer this medical technique to their patients, which they did. And what they described was that on several occasions, injecting this particular substance into the body in various ways caused improvement in other ailments or other illnesses that the patient did not actually seek help for. So, for example, in 1940, Ferdinand injected the painful shoulder of a woman who had a problem with her leg, which at that time would have led, based on the diagnosis, she had a really bad infection of the bone. It would have put her at risk of having the whole leg removed. Remember now, he injected the shoulder because her shoulder was painful, but her problem was really in her leg. To his surprise, he found that the shoulder pain improved just by injection of this substance, and the leg became itchy. And so he injected the leg with a little bit of Novocaine, and the shoulder pain disappeared. And so he referred to this concept as a secondary phenomenon. I want you to sit and absorb some of what I'm saying here. So what was happening was, listen again, he injected the shoulder and the patient felt a change in their leg. Then he injected the leg and the patient felt a change in the shoulder. Remember, in the first part of this episode, I mentioned that the body acts like an electrical circuit with multiple different interconnected, a network of various electrical wires all communicating. So I don't know if any of you have ever had this experience where you're scratching an itch on one part of the body and you feel a sensation on another part of the body that's far away. It happens to me quite a bit. And so what that means is that there are areas of the body that are closely connected to each other because they, for want of a better word, they're on the same circuit. And for those of you who have done any sort of peek into Chinese medicine, you would know that the practice of acupuncture refers to these circuits as meridians. They are the electrical lines or energy lines that the information or energy or electricity, or however you want to frame it, travels on these lines. And so you can have several parts of the body that are on the same circuit or meridian. And so a problem in one area of the body can affect another area of the body that is on that same circuit. The area of the body that is having a problem is referred to as an interference field. An interference field. And an interference field, in the easiest way that for me to explain it, is simply that there's a short circuit there. So whenever the electricity needs to be sent across that particular wire, there's a short circuit on the wire and the information does not get sent properly. It gets stuck somewhere along the line. The voltage is different somewhere there. So the patient may complain of pain. They may complain of a change in sensation. They may complain of a temperature issue. But remember now, they may not necessarily complain of a symptom exactly where the problem is. They may complain of a symptom at an area of the body that is on the same circuit. As usual, I'm going extremely slowly. I always welcome your comments, and I would love if you could provide some for this particular topic, because I recognize that it's a little bit it's revolutionary, although it's 99 years old. I must admit that when I first got exposed to these concepts, they were a little bit difficult to absorb because it doesn't stray far away from what we learned in medical school, but the approach now has to change, because if a patient complains, one of the most common things that will happen to me is that a patient comes in and complains of, for example, a pain in their big toe. And my approach to that, having taken a careful interview, made a careful interview and taken a careful history of this patient, most of the time I will ask them, well, do you also have pains, for example, in your elbow on the same side? And they say, well, doc, come to think of it, yes, I do, but I thought it was just arthritis. And I'd say, okay, thank you. Do you happen to have pain in the shoulder on the same side? Doc, how did you know? I'm always having the shoulder pain. I don't know why. All right. Do you have pain at the back of the knee on the same side? Yes, doc, I actually do. How did you know that? All right, cool. Do you happen to have headaches? Yes, doc, I actually do. How did you know? And ultimately what I will find, this is one of those wonderful moments on the Healthy Reasonings podcast. Ultimately, what I will find is that this patient has a problem with a tooth on the affected side, on the same circuit as where they're having the complaint that they came in with. And because I've been studying these various circuits or maps or associations or meridians, I can visualize in my mind how the circuit is running through the body and figure out exactly where the problem could be. And so after that, it's just a simple matter of narrowing it down to the various possibilities and finding the affected area, or as my healthy reasoners now know, finding the interference field, the short circuit, the area of the body that's not running at the right voltage for whatever reason. So the question is, therefore, what are the reasons why somebody would have a problem creating an interference field, which then leads to them having issues with that electrical circuit or symptoms related to that electrical circuit? And we will find that out right after this short break.
Are you enjoying this episode? Remember, We are depending on you to help this podcast grow. Take a moment to leave us a 5-star review in your podcast app. Go ahead. We'll wait. All done? Okay, now share this episode with 5 friends. Thank you.
Okie dokes. So we have a few questions. I'm going to pretend that I am a healthy reasoner on the other end of this broadcast. So I'm speaking into the mic. You're listening through headphones or on your phone or on your TV. I hope you're listening and sharing with your friends after listening, or maybe even while you're listening, because that's exactly how this podcast will grow. I welcome you sharing with your friends. We have just a few more listeners to go before we hit a total of 100 regular listeners every week. And that's a significant milestone. So I want you to share with a few of your friends. But whilst we're on the topic of what we need to cover to answer your questions, I think a critical question right now that you may be having is, why would I have an interference field? And how do I know if I have an interference field? Well, the truth is the most common reason for an interference field are two that I encounter almost at least 3 times a week in my practice. Number one, I just gave you a gem a few minutes ago. Number one is a tooth. Often teeth that are damaged, broken, chipped, or otherwise have a problem with the nerve running under the tooth will create an interference field which can affect other organs, joints, and areas of the body on that same circuit. Which means, therefore, that we need to be very careful about how we care for our teeth. And the good news is that over the past few years, since being trained in these techniques, I've developed good relationships with quite a few dentists who understand quite well what I'm saying and what I need to help my patients and are cooperating with me. The second most common reason for an interference field is a scar. It can be a surgical scar. It can be an old wound that you may have picked up even as far back as childhood, and it only creates significant interference later on in life. And I'll probably tell you some stories about that in a subsequent episode. But for now, we are going to focus on the foundational principles. So, a surgical scar, if you could imagine an electrical wire running from your breaker box to your fridge, and somewhere along the line, something happened to the wire. Either by accident it was cut, or something along that line happened and it wasn't taped up properly. The electrician did some faulty electrical work and didn't repair or insulate the line carefully after working on it. And now you have a short circuit or an area of a change in voltage. That's exactly what a scar can behave like, because in the process of doing the surgery or in the process of the wound healing, the connections that the nerves once had are not always restored completely to where they were before. And so as a result of that, there's a very real risk that the nerves will not communicate. The origin of the nerve and the ending of the nerve may not rejoin as well as they should. And so you might have an interference field developing there. And I see it all the time. Scars are notorious for causing interference fields. One of the most common things I'll see in my office is a young lady who comes in complaining of terrible migraines. And of course, by the time she comes to see me, she will often have exhausted all the migraine treatments via tablets and all of these different things that she would have tried. And I have nothing against them. But in the event that those have not worked, that is when the patient becomes very keen on finding something outside of the box because migraines interfere with one's ability to function. You can't be a great mother or a great manager or a great medical professional or legal professional, whatever the case may be, if migraines interfere with your ability to do your job. So anyway, she comes in to see me and I said, well, when did the migraines start? And she usually gives me a vague answer, not quite sure, but it may have been about 10 years ago. And I said, come to think of it, do you have children? Well, yes, doc, I do. And how old are these children? And she'll say, well, the first one is 10 years old. And a light bulb goes on above my head and I say, hey, did you by any chance do a C-section to have this child delivered? And they say, doc, how did you know? And I say, well, because I'm asking about interference fields. And this is a very common one. And the story almost invariably goes on to me saying, may I be allowed to offer treatment for this area of the body? And they say, well, what do you need to do? And I say, well, following in the footsteps of several great neural therapy practitioners long before my time, I would like to inject a very safe local anesthetic by the name of Procaine. Just inject a little bit into the scar and see what happens. They sign their consent form and waiver and they say, are there any side effects? I'll explain to them, well, the injection is painful, that's a side effect. Rarely we can see infection of the area, which could happen with anything. That's a potential side effect. And we go through the form. The truth is that this procedure has been done in various iterations, I would say at least 100,000 times. And I'm being very conservative over the past 99 years. And we're yet to see records of anybody having any untoward effects. And we're talking about the Hunike brothers who published an entire manual of hundreds and hundreds of cases that they've treated successfully. Other doctors taking up the mantle and not having any side effects documented. Myself, I've been doing this since 2017, not seeing any side effects. But sometimes it sounds too good to be true. Anyway, I'll inject the area and within a few minutes, the patient will say to me, wow, doc, I just felt like something just lifted off my head. My head feels so light. I feel very relaxed. And this tight sensation that I had around my forehead is gone. And in almost every case that I've treated, the patient then has complete resolution of their migraines. Is it a perfect procedure? No. But the principles are sound and the effects are usually very positive. So that's one example. I want to speak a little bit quickly about Procaine though, because there's something fascinating about it. And here's what's fascinating about Procaine. Procaine, after it exerts its effect on the body, it is broken down into a substance called para-aminobenzoic acid, or PABA. Para-aminobenzoic acid, or PABA. Now, the cool thing about para-aminobenzoic acid is that it is extremely helpful to the body. So here we have a substance that is being broken down, and after it has done what it needs to do, Procaine that is, it's broken down to para-aminobenzoic acid, which is otherwise known as vitamin B10. So we're having benefits to both ways. Anyway, that's another discussion all over again about vitamin B10. But the point I'm making is that the substance that's produced when Procaine has finished working is extremely helpful to the body. So what this means then is once we have a working knowledge of the different areas of the body how the circuits are formed, where the circuits connect, where we have areas where multiple circuits join. If you're picturing a circuit board, just imagine multiple circuits joining at one place. In conventional medicine, that's referred to as a ganglion. Then we have the opportunity to find critical points across the body in which we can gently inject this very helpful and safe and non-toxic substance into the body close to the area where the interference field is, and to allow the body to respond to this substance and to clear the interference field and start the process of healing the damaged areas, because the nerves will start functioning well again. And the beautiful thing is, as I said before, when that process is finished, the breakdown product is PABA, which is extremely helpful for the body's healing anyway. So we're getting a double benefit. So Procaine is widely used in my office and in the offices of several of my colleagues across the world. But in Europe, this technique is otherwise known as European injection techniques, let's just call it that. And so when you go to Germany, for example, it is widely practiced. What does that tell you? Well, if we have an entire country where the technique is common, similar to acupuncture in China, which I'm sure several people embrace wholeheartedly, then neural therapy should be no different. And in fact, if you've been keeping an eye on social media and current affairs, you will notice that in about 2022, maybe a little later, 2023, you would have seen a very popular video of a young lady at a very well-regarded hospital in the United States. And the video starts with her mentioning that since contracting a particular illness, which caused a global problem over the past 3 years, she had lost her sense of smell completely. And in the video, we see where the doctors had injected an area of the body known as the stellate ganglion. The stellate ganglion happens to be an area where several circuits for the head and neck meet. And so the doctors injected that area of the body. Essentially what the doctors did at this conventional, well-regarded, brand name United States hospital is they performed neural therapy on this lady, and they watched to see her response. And as the video unfolds, you could clearly see her regaining her sense of smell within what looks like minutes based on the video. And the delight on her face, because she's experiencing the clearing of an interference field, a damaged electrical circuit in the area of the nose and the olfactory neural pathways. And she's getting back her sense of smell. Can you imagine how much that means to this lady? I think in the video, if I remember well, they offered her coffee to smell and she could smell it, and she was so excited. And the list of potential areas that can be helped with this technique is really limitless. What it requires is simply somebody who has a good understanding of two things. One, the different pathways and how they map against the person's body, the patient's body. And two, good injection technique and understanding where the injection ought to be given. I've been doing this since 2017, so I'd like to think that by now I'm getting closer to having both of those qualities. So I'm happy to say that my results they were good from the very first time I started, but they're getting even better with time. And some of you that are listening are my patients who have benefited from this kind of work. I think what I'll do in subsequent episodes is one of two things. I'll probably bring on a patient who has had injections done. That's one possibility. Or I may speak a little bit about what I do in specific situations for specific concerns. And I think that, if you are somebody who has one of those symptoms or concerns, then you're going to find it very useful information to find out how that works. But neural therapy, you can look it up. Very useful technique. One of my favorite tools, easily my favorite tool for treating common illnesses. I'm going to list some of the things that I have treated over the years using neural therapy. I mentioned migraines already. I also treat quite commonly headaches, not migraines necessarily, but headaches. Issues related to, my favorite case, I'll tell you about this one. A lady came in to see me who had had surgery on something called a pituitary gland. Very tiny gland right in the center of the head. And she had had the surgery, and unfortunately, having had the surgery, when she emerged from the surgery, she found that she could not feel the right side of her face. She could not feel the right side of her face at all. And somebody told her to come and see Dr. Andre. At this time, I was still maybe just a year into this whole practice. I trained in 2017, got my certification, and I probably would have been practicing for about a year. So still putting the pieces together, learning as I went along. But when she came in, the first thing I could have done would be to say, it's because of something that they did during the surgery. However, something about what she said just kind of reminded me, hey, Andre, think about neurotherapy. And that's what I did. I said, ma'am, are you having any other concerns? And she said, well, yes, my right shoulder is also stiff. My right elbow is also stiff. And by this time, I'd learned enough to understand that there's a circuit that connects the right shoulder, right elbow, and the right side of the face. And healthy reasoners will know what I did next, which was to say, ma'am, could you please open your mouth? She did. And I took a quick look and realized that she had two very pretty pieces of metal in the mouth at a particular tooth that would have been connected on that circuit. And I said, ma'am, would you mind allowing me to inject a little bit of Procaine just into the gum and numb those two teeth? And of course, she said, Doc, whatever you can do at this point, I don't really care. I'm just happy to try anything because I'd love to feel my face. And I injected a little bit of Procaine into the gum at the area of the teeth. And I still can't believe what I saw happen next, which is that her face became just so happy, first of all, almost immediately. And she said, Doc, within seconds, she said, Doc, my right shoulder feels less stiff. She started moving her shoulder around. Then she said, my right elbow feels less stiff. And then her face just breaks out into a smile. And she says, Doc, I can feel the right side of my face again. I can feel it. And I don't know who was more happy, she or I. I think it was probably quite possibly me, which tells you a lot. And this lady was ecstatic. She walked out of there able to feel her face again for the first in months, and also able to lift her hands above her head on both sides because her shoulder was feeling better. Now, mark you, that was not a permanent solution in her case because she would need to then go and have that interference field carefully attended to by a dentist, which is one of the things that many of my patients have to do. They have to go and see the dentist where the interference field is a tooth to get that fixed. And when they get it fixed, I've seen amazing things happen. So, we've spoken quite a bit about neurotherapy today, and as usual, I've tried not to make it too academic. I've shared a little bit of my experiences. I've shared about what Procaine is. I've shared about how we inject it, which is usually under the skin, but sometimes we inject it intravenously in some cases. And I wanted to leave you with this little tidbit, especially for the ladies who always ask me about this. Procaine has been repeatedly demonstrated to help with inflammation, but also more and more we're seeing where it is helpful for anti-aging. And so more and more cosmetic, let's use cosmetic surgeons or people who practice cosmetic surgery of various kinds are recognizing that procaine can be used, for example, on the face to help to improve the youthful appearance of the face. Widely demonstrated that procaine, when used in the right circumstances, injected appropriately, can help with regrowth of hair for those who struggle with hair loss or balding. There are different things that we have seen and continue to see, and the originators of this useful technique had already demonstrated so much in their time and their career, and we're just building and standing on their shoulders. Imagine that. So neural therapy, I don't know what more I can say about it other than to say do your own research, look into it. It's slowly coming over from the so-called alternative stream into the conventional medicine stream, which is where it ought to have been anyway, because the doctors who discovered it were indeed conventional doctors, surgeons no less. But anyway, those are some of my experiences with neurotherapy. I want to encourage you again to leave your comments where you can. I know some people had written to me saying that they weren't sure how to leave comments on Spotify, but when you do, I will respond. I also wanted to tell you that our next 2 episodes of the Healthy Reasoning podcast are going to be extremely interesting because we will be having back-to-back guests. Our first guest will be a success story, a very popular gentleman who you will all likely recognize, who will tell us a story of how he and his family helped their child to overcome cancer. And the next is going to be the expert that was promised to you. I did say that following last week's bombshell episode on glyphosate, I'd try to bring an expert in to tell us a little bit more about the areas that I may not have been able to adequately cover because it's not my area of expertise necessarily to speak about how it is used agriculturally. I just know the impact it has had on my patients. So I thank you for listening to this episode of the Healthy Reasonings podcast. And as usual, I look forward to hearing from my healthy reasoners. Please leave a comment so I can get some interaction with you. I'm happy to answer any questions you may have as best as I can. Goodbye and God bless.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice memo on Spotify or type your questions out in the comments. For more information or to become a sponsor, please check the show notes for our contact information. See you soon.